Hello, everyone. Um, Welcome to our special show of Athena. Uh, yes, the live has just started. Uh, so, uh, what we are going to talk about today, breast cancer is the most common cancer. Usually, we don't want to talk much about this. Breast cancer has been known since ancient times with no relatable treatments and with surgical outcomes often fatal. So, women tended to conceal the possibilities of breast cancer as long as possible. Time has been changed now, and there are lots of modern and updated treatment facilities uh, all over the world, but still in our stigmatized society we don't want to talk about this much. And today our program's vision is to our people about breast cancer, and our programs which is titled as Know About Breast Cancer and Its Management, powered by Fortis Hospital, Mulund, Mumbai, India. Me, Mrs. Sabine Chaudhary, mental health counselor from Athena Limited, is welcoming all of you in our special show, in our special program, and our media partner is Radio Aamar 88.4 FM. Before starting the program and before welcoming our speakers and the main discussion, I would like to play a short video, short intro about this program. So, yeah, I'm saying stay connected with us, coming back soon.
Hello friends. Breast cancer today is the most common cancer. Almost 1,50,000 to 2 lakh people every year are diagnosed with breast cancer. And believe it or not, it all starts with a simple lump which has neither pain, nor fever, nor any other symptom. If some people ignore it, it increases, spreads throughout the body, and can become fatal. Very easy to diagnose. It is just that one needs to have a consult and then do a test called as mammography, which can detect more than 90% of these lumps. I would highly recommend that women over the age of 50 should get themselves screened for breast cancer every year from the age 50 to 65. It's a simple mammography test, gets over in 15 minutes and can really save lives. Treatment today is much easier. In fact, people do not have to remove the entire breast also. Breast conservation techniques have improved. Survival has increased by leaps and bounds if patients are diagnosed in early stages. Stage 1 breast cancer has a cure rate of 95 to 97%, which is as good as 100%. So please do not ignore lumps which are painless. Come to the hospital, get yourself diagnosed, and remember, a stitch in time saves life.
So, welcome back. And আমি একটু সবাইকে জানিয়ে দিতে চাই আমাদের যেহেতু আজকে যে আপনারা আজকে একটা এই ইন্ট্রো ভিডিওতে অলমোস্ট একটা মেসেজ আপনারা পেয়ে গেছেন, এবং এই মেসেজটা আমাদের যিনি আজকে স্পেশাল গেস্ট ফ্রম ফোর্টিস হসপিটাল মুম্বাই, উনি আমাদের সাথে আছেন। আমরা টোটাল প্রোগ্রামটা একটু ইংলিশেই করতে হচ্ছে যেহেতু আমাদের ইন্টারন্যাশনাল গেস্ট আমাদের সাথে আজকে থাকবেন, এবং আমাদের এন্ড থেকে আমাদের বাংলাদেশ থেকে একজন খুব প্রমিজিং এবং আপনাদের সবার অতি পরিচিত মুখ একজন অঙ্ক সার্জন আমাদের সাথে আছেন। আমি একটু পরেই পরিচয় করিয়ে দিচ্ছি। আমি একটু জানিয়ে দিতে চাই, আপনারা যারা কমেন্ট করছেন বাংলায়, অবশ্যই আমরা চেষ্টা করব পুরো জিনিসটা যাদের ট্রান্সলেট করে দেওয়ার জন্য এবং আপনাদেরকে প্রয়োজনীয় পরামর্শ পৌঁছে দেওয়ার জন্য। তো ফার্স্ট আই উড লাইক টু ইনভাইট দ্য মোস্ট প্রমিসিং অ্যান্ড কোয়ালিফাইড onco-surgeon of Bangladesh, consultant Department of Surgery, Holy Family Red Crescent Medical College and Hospital, and City Hospital Limited, Dr. Afrin Sultana from Bangladesh. Yeah, Rafni Sultana
Hello,
ma'am,
Nusrat.
welcome to our
কি
show.
অবস্থা?
Yeah, how are you?
All good?
এই তো
I'm good, I'm
কেমন
good,
আছেন?
আলহামদুলিল্লাহ। এই তো
আহ,
আলহামদুলিল্লাহ ভালো আছি।
থ্যাংক ইউ সো মাচ আপনার ব্যস্ততম সময়ের মধ্যে আমাদেরকে সময় দেওয়ার জন্য।
It's always a pleasure. Hopefully, inshallah, it will be a good program.
Yeah, inshallah. Uh, so, well, already we are getting so much comments. Thank you. Thanks, all of you, for staying with us. And it's a great pleasure to invite our special guest, one of the senior oncosurgeon of India, Dr. Anil Herer, head of the department and senior consultant, Fortis Hospital, Mulund, Mumbai. Sir, welcome to our show.
Thank you, Nusrat, and hello, Dr. Afreen. Good to see you, and thanks for organizing this. It's a great pleasure. Good work you're doing.
Thank you so
Hello,
much.
hope you're doing good
And
and welcome.
Thank you. Always a pleasure.
okay, so I want to yeah, I want to start our main discussion. So first, I would like to ask Dr. Afrin ma'am. That's a general question. Actually, people want to know what is breast cancer, and please kindly let us know the scenario of the breast cancer patients in the subcontinent, especially in Bangladesh.
Okay, thank you so much, Nusrat. So basically, breast cancer is like any other cancer. So what happens when a cancer it appears in the body? It's what happens in our body regularly. The cells are multiplying, generating every day. So when it becomes incoordinated or excessive, our body cannot control it the way it should be, then it gets into the cancer type of diseases. So for normal people, what they need to know, যখন সেটা কোনো কন্ট্রোলে থাকছে না, একটা ডিজিজ যখন সেটা আনকন্ট্রোলড হয়ে যাচ্ছে, ইনকোঅর্ডিনেটেড হয়ে যাচ্ছে, তখন আসলে এই ধরনের ক্যান্সার জাতীয় রোগগুলো হয়। So it's basically it affected by the genetics and by the environment as well. Different কারণে আসলে changes গুলো হতে পারে. So I'll try to be using both languages, English and Bangla, so
Four languages, yeah.
understandable as much as possible. So basically, so cancer is like this when this kind of influence that could be genetical or environmental influence that leads to this kind of incoordinated growth that leads to development of a cancer. So like any other cancer, breast cancer is like that. So when the cancer is happening in the breast, then we are calling it the breast cancer. So, as in the intro video, Dr. Anil was saying that it's the number one cancer in whole world. So basically, it was a cervical cancer before, but there is a specific cause for cervical cancer, which is the virus, human papilloma virus. So the vaccine is invented, and we are preventing the disease. So that cancer rate has become reduced, but there is no such thing for breast cancer. Which that is one of the questions that I get often asked, that whether there is any cure or anything preventive for breast cancer. There is nothing like that. There is no specific cause that we can identify which can be treated or which can be, or people can get vaccinated. So breast cancer is becoming the number one cancer worldwide, not only the subcontinent or Indian subcontinent or Bangladesh or India, everywhere is the number one cancer. And in fact, it is the leading cause of death related to the cancer. So Bangladeshi scenario is kind of, I think, similar like the Western world, or if we say the subcontinent region. And I don't know exactly the scenario in India right now, but what we see in Bangladesh, there are a few things which I can say from my observation. Definitely, he's more senior and has more experience on that. But on my experience, what I can say in Bangladesh, what we see, most of the patients are coming to us at very advanced stage, which is not a very good thing, that we don't want to have the patients and the disease at the advanced stage. We want the patient to come to us at a very early stage. So which is still, we are not there. We are getting most of the patients, almost 80% patients, we are getting at a very advanced stage. So when the disease get advanced, we don't get the benefit of the treatment of it. As the doctor is saying, that if we get the patient at early stage, we give the proper treatment, patient can be cured as much as like 100%. So we are still on a very back foot, I think, on that perspective, because we are not getting the patients at early stage yet. And another thing is we are getting patients at very early stage, like their third decade. I get many patients around 27, 28, 35, 32, when they're like just starting their life as a married couple, or they're getting their babies or breastfeeding at this period of time. And at this time, they are getting very early stage the cancers are really, really aggressive, and the cancer biology is also very aggressive. So these things, I think, are very different. What we read in the book, those are based on the Western studies. So I think these are the things that are different in my perspective, especially in Bangladesh. So I'd like to know the situation of India as well. How is it like? Is it like similar to Bangladesh, or is it different?
Yeah.
Yeah, Afrin, can I come in?
Yeah.
Yeah, no,
Yeah,
sir.
sure, please.
Yeah, Dr. Afrin, I think you have hit the nail on the head. Absolutely. Breast cancer is something like an epidemic. Now, people are very used to the word pandemic. So, breast cancer is really like an epidemic, and it has grown by leaps and bounds. So, in India, breast cancer also used to be the number two cancer till recently, but now it is the number one cancer. And interestingly, breast cancer is not only number one cancer in females, it is also the number one cancer in males and females combined. So it is the number one cancer. So that's the kind of volume that breast cancer has. So it is approximately about 1,50,000 to 2 lakh females getting diagnosed with breast cancer every year. Out of this figure, 1% of them are males. So, a lot of times people think males are not going to get breast cancer. That's not true. Males can get breast cancer. Of course, the proportion is very, very small, but yes, males can get breast cancer too. So, the numbers are becoming more and more. It is also one of the leading causes of death as far as cancer is concerned, and it generally also. Luckily, the awareness, at least in urban areas, has increased a little. So we do see patients a little early, but if you go outside the city, yes, the situation is bad. People do tend to hide their symptoms. People are very reluctant to speak. There's some amount of shame there. So definitely, people are not really coming up with those symptoms. And yes, we also see a lot of younger women with this. So generally, the Indian patient is about 10 years younger to the Western counterpart. So these are young women.
True.
Absolutely, and that's really a tragedy. So a lot of times, at these cancers are aggressive, as you very very rightly mentioned. Lactating women sometimes develop these cancers which go undiagnosed, and a lot of times even physicians sometimes are they go to traditional medicine because they are lactating, and then the diagnosis gets delayed. In fact, the regional cancer center in Calcutta did a study where they actually found out that there is a 4 months delay before a woman actually comes to the hospital for getting diagnosed with breast cancer. So you can realize that, and 4 months for cancer is a long period. So that's the situation. It's not
Right. And that's
it's a little
actually very
sad, but
important to let
yeah.
people know, because why people think usually people get cancer at their later age, when people get older or elderly. So that's the thing I think people need to know. Breast cancer, it can happen at a very early stage. What we are seeing, especially as doctor said already, that the scenery is kind of similar in Bangladesh and India as well. We are getting patients at a very early stage. So people need to know this. They need to be aware of the disease from the very early stage, not like when they're getting to their 50s or 60s, not like that, because no one is immune. And also, as you mentioned, it's very important to know that male patients are also getting the cancer. So everybody needs to be very concerned about it and aware of it, so that we can treat the patient at the early stage, so that they get the benefit of the treatment and they get cured.
Absolutely,
Uh,
absolutely. Awareness is the key.
yeah.
True.
Thanks, both of you. Dr. Anil sir, I would like to know the symptoms and risk factors of breast cancer, please.
So let me come to the risk factors first, which Dr. Afreen has obviously mentioned a few.
Yeah.
Definitely, breast cancer. There is no definite cause for breast cancer. So there are many reasons that may lead to the development of a cancerous lump in the breast. So one of them is basically obviously increasing age. So though we may say that we are seeing younger patients, it is definitely more common as a woman becomes older. Age is a factor. Being a woman itself is a risk factor. Unfortunately, I'm speaking in front of two beautiful ladies, but unfortunately, yes, being a woman itself is a factor, and it can cause because 99% of breast cancers happen in women. So that is the second. Secondly, what is happening today is girls are getting their puberty early, and menopause, you are seeing women continuing to menstruate even after 50 years. So your reproductive age has become longer, and they are having fewer children. So what is happening is that the breast is getting exposed to more and more menstrual cycles, which also probably leads to is that's a speculation that it can lead to increase. Of course, this is not to say that everyone should have 14 children. That's not my point. But 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 that's the truth. That's where we are. So that's another thing. Another thing that doctor mentioned was about the environmental factors, and here obesity is now looked upon as one of the risk factors for breast cancer. So lack of physical activity, obesity, so changing lifestyle, stress, all these things also come into play when cancer is concerned. And finally, there is the genetic factor, that is hereditary factor. But hereditary sometimes tends to get stressed quite a lot, because there is no obvious cause. So when the doctor asks if you have had any relative who has had breast cancer, so people tend to link it with being a very, very important thing about breast cancer. But in reality, it's only about 5 to 10% of women who will have a family history of breast cancer. The rest of the cases are all sporadic, and especially in the subcontinent, we have to be very conscious about this, because a lot of time nowadays I get people who come with large files, that we are going to have a marriage proposal, and the boys or the girls family had a case of cancer in their family. Will this person also get cancer? So that's a concern in the societal context, where we have conservative societies yet. That's a big concern. And that is why people need to be aware that even breast cancer happens. It's like a family of cancers, so breast cancer, ovarian cancer, uterine cancer, colon cancer, that's like one family. So if that girl's grandfather had developed a throat cancer because he used to take tobacco, it does not mean that the girl is going to get breast cancer. So let us be very clear on that. Let's not confuse issues. So familial cancer, small group, and of course it has to be a history linked to this family of cancers, not any cancer. As far as the symptoms are concerned, as I mentioned in that small intro, it all starts with a very small lump in the breast. Lot of women feel it, most of them ignore it because it is painless. So painless lumps are something which have to be considered as absolutely dangerous. It is not something, it doesn't come with a big red flag, because people tend to think cancer is a big disease, so it has to have some great symptoms. There have to be horns blowing, there has to be red flags all over the place. Nothing like that happens. It's a small lump, painless, and hence people tend to ignore it. If people ignore it, it becomes larger. Then the breast tends to become swollen. There are glands which develop in the armpit, and then you can also have nipple discharge, which tends to be bloody, red, or blackish in color. It can also happen then that the cancer spreads, and then the symptoms related to spread happen. That if it goes to the bones, then people can have pain in the bones. If it goes to the brain, then they can have symptoms related to that. If it goes to the liver, then people can have jaundice, people can have loss of appetite, and so on and so forth. So those are the symptoms. So we have to remember that a painless lump in the breast is something to be taken seriously. Not to alarm, 95% of these lumps could still be non-cancerous, but it's like airport security. So you have a terrorist attack once in 25 years, but then all of us have to remove our shoes and remove our belts and keep our purses for checking. So everyone goes through security just because of one attack sometime which has occurred in 1 century. So it's like that. For all that 5% lumps which may be cancerous, everybody has to undergo checking. So be aware of the painless lump in the breast. That would be my message.
Dr. Mem, would you like to add something?
Oh, that's a very important point, actually. What happens, especially in what we see in practice, unless anybody is having any pain, they don't take it anything as a serious issue, or they don't even take it as a health issue or anything. And in fact, the women in our society is always, they are willing to sacrifice their health over anything. Like they are more concerned about their family, their husband, their children, whatnot, but not about themselves. So when it is not causing any problem like pain or anything, so they don't get, they don't put the emphasis on that, that it's an important health issue, you need to go through some checkups or anything. So of course, it's a very important thing that to remember that pain is not always the main symptom that you need to consider. Most of the patients, they come to me, they come with the breast pain, what we call mastalgia. But most of the time, those are like very simple things like cyclical mastalgias, which are the physiological changes, but they get concerned about it because it's causing pain. So any kind of lump actually in the breast is very important to go through checkup, because as we're saying, the age is, there is no limitations of age. People can get cancer at any age, though it increases with the age, but it doesn't matter that if she's 25, she's not going to get the cancer. You never know. As he's mentioning, you never know which one is the case. So you can't ignore the fact that you have a tumor in your breast or you have a lump in your breast. It could be the normal tumor, but it can be the cancer as well. So it's very important to go through checkup and make sure of it, it's not the cancer. So of course, that's, I think it's a very important message to know, whether it's painful or not, any kind of breast lump, people need to go through the checkup with the surgeon. And another point is what happens in our country. I don't know what's happening in India, but as we are, it's a very conservative society, but religiously or whatever you say,
Yes.
and we are dependent on male person for any kind of treatment or monetary issues or whatever. So people tend to go to the gynecologist for the checkups or treatments. But what happens, they're not properly trained to treat these kind of diseases. So at that point, sometimes we miss the, disease, how it needs to
Yes,
be
Dr. Afrina, I would
sorted.
like to interrupt. As we got a comment related with your yeah, Yasin Munshi has connected with us, and he said, yeah, Dr. Afrin is really professional in this field, and you guys are giving awareness through the social platform, and it's quite appreciated. But in every district in Bangladesh, women are not aware of it, and also local gynecologists, what we were talking about, who serves in this field, they are very and treated very badly to patients, unfortunately.
Uh, okay, so the thing is, actually what I was trying to say, it's not that they're doing actually a great job, because he has pointed a very important thing, that we don't get the chance to see surgeons everywhere because we don't have adequate number of surgeons everywhere to see the patients. So at least it should be an MBBS doctor who have the knowledge that what it should be. They should know about the triple assessment process and go through it. So what's important, that we need to develop the program so that we can train the people who are dealing with these kind of diseases. It can be an MBBS person, it can be a gynecologist, doesn't matter. Whoever is the doctor, he or she is entitled to see the patients and deal with it, but they need to have the proper knowledge, proper training about it. So that's my point actually, because people are going to the gynecologist a lot, so they need to have that development in themselves as well to deal with the patients. So what we face is they're seeing the patients, but they don't know how to deal with those patients or how to treat them. So lots of patients are getting maltreated actually. So that was my point. So you need to know where to go for this. So uh, so the thing is,
Exactly.
I'm actually lost where I was, where I started talking. So the important thing is, whatever the symptom is, whether you're going to MBBS doctor or the gynecologist or surgeon, the doctor has to be responsible for this and take care of it. And whatever the symptom you're having, if that is there for like more than 2 weeks, I think you shouldn't ignore the symptom, whatever the symptom is, not only the pain, whatever the symptom you're having, just go to the doctor, check it. And if they think it's important to refer you, they will refer you to the surgeon for further evaluation. So, yeah, I think that's all from my side on this topic.
Thank you so much. Dr. Anil sir, there's a question for you. Shanta Islam has joined with us, and can anyone die from stage 1 breast cancer? She asked.
Can anyone die from stage 1 breast
Yes.
cancer? So, basically, as I mentioned in the intro, so most of the stage 1 breast cancer patients get completely cured. So 97% of them will continue living the life that the God has built for them. Unfortunately, a small proportion, about 2 to 3%, may relapse and may succumb to the disease. So it can happen in that way, but the chances of getting cured are definitely more. It is better than, definitely, in fact it is more than surviving a heart attack. A lot of times people, like in India, there's a in Gujarati, I am sure many people know about Gujarati. There is a saying that cancer થઈ ગયા તો પછી માણસ cancel થઈ ગયા. So which means that if a guy gets cancer, then he's cancelled, which is unfortunately not so true. Because remember, if you go by heart attack statistics, people think heart attacks are curable. But do you know that 60% of heart attack patients never reach the hospital? It is only out of those 40% patients who reach the hospital who get treated well, probably come out of it. So cancer is actually better than that. Cancer, if you detect in the first stage, 97% of the people do have a chance of leading normal lives. So that is where the focus should be.
Well, Mohammed Noman has asked which stage of breast cancer is curable. So stage 1, 2, or 3. Like,
should I speak? Yeah. So
yes, yes.
basically, I think, yeah. So unless the cancer has spread beyond the breast, okay, which we call as metastatic breast cancer, which means it has gone to the liver, lungs, and brain, it is definitely, there is a chance of cure, though the chances of cure go on decreasing. Okay. But even in stage 4 cancer, there is now promise, and there is a small proportion of patients who definitely have a chance at cure, and if not cure, at least they can have a good extension of their lives if they get the right kind of treatment. Again, I would like to bring an analogy from real life here. A lot of times people think that it is only about cancer or these diseases that happens. Even in real life, it happens. If you notice, sometimes you have a plant. What is a stage of cancer? So stages of cancer is like, you have a plant growing out of a building. If it is small, you just pluck it out. You ask your son or daughter to pluck it out. The small kid will also pluck it out without any problems, without giving any problems to the structure, right? So that is stage 1. But if you allow it to grow, then you require strength to pluck it out. You need to pour in acid. Then it becomes even more difficult. If it is staged, if it goes beyond that, then you have to call in professional help. The plumber has to come, replace the pipe, and if somebody thinks that let it be, let's see, let the government and the municipality look after it, then it can even cause the fall of the building, right? So this is something like that. It is exactly like that. So it is not that only cancer is incurable. Anything that is not treated in time becomes incurable. So basically, if you are diagnosed in a stage where the cancer is limited to the breast, we have a shot at cure. If earlier it is, the smaller it is, the better are the chances of getting cured. But now, thanks to advanced technology, advanced medical techniques, medicines that are available now, even in advanced stage. Now, suppose you have the cancer has spread to the liver. People have become now so aggressive in treatment that they will go ahead, give chemotherapy, and even go do surgery on the liver as well. So I hope that answers that question.
Thank you so much. Dr. Afrin ma'am, actually, what is breast self-examination? Is this a useful tool for early detection of breast cancer?
Self-breast examination actually useful, of course, especially countries like ours where we are in lack of technical supports and especially the economical support. So as in your intro video, doctor already said that mammographic screening is the most important tool to pick up the cancer at the early stage. So where we use the screening process or screening techniques, those are the, you can say, investigations or techniques that we use to pick up the disease earlier when it causing the symptoms, even before it causing the symptoms. The patient doesn't have any symptom, but we can still find out the cancer. So screening techniques are for those. But for that, you need to have those technical support and economical support as well. So as we don't have it that much, we don't have mammographic screening facilities, even in all the hospitals. In our tertiary level hospitals, we don't have the facility. So we depend on something, or we try to rely on something that can help us to pick up the disease help us getting the disease at least as earliest as possible when the patient is facing the symptoms or facing the problems, so that they can detect it and come to us as early as possible. So that's the point. So self-breast examination, I think it's a very, I won't say most reliable, but I think most helpful thing for us if we can teach the patient how to do it and when to do it. So what we suggest after the age of 20 years, every woman should go through this test once a month at least, when their period is done, or what we say, when the menstruation is done, then they can go for the self-breast examination. And it has to be done in different postures. And there are techniques for that. There are two steps actually. One is looking at it, and another thing is how to feel for it. So by looking, the symptoms, the Dr. Ronil already mentioned that whether there is any dissimilarities the patient can see in the breast, anything unusual. It can be like changing the shape of the breast with a big lump, or the nipple is getting inside, or the patient is seeing any kind of discharge, or there is any kind of skin dimpling, or sometimes there is some kind of, pore kind of things. In fact, patient can understand the skin has changed compared to the other breast, as like the skin of the orange, or there is something under the her axilla, or what you say, that underarms, or in the neck, anything unusual. If the patient notices anything unusual in the breast, they should go for a checkup. And for feeling, what is the most common symptom is lump. So when we tell the patient to feel for it, so that they can touch their breast every month, initially they don't get to understand what they're looking for. But when you practice it every month, they eventually get to understand what they're looking for, how the breast normally feels to her. And if there's anything unusual or anything, any kind of lump she's feeling, then she comes to doctor earlier. So that's the main point of doing the self-breast examination actually. And it helps, and literally it helps. There are so many girls there coming to us when they're feeling the lump. It was not there like
Mhm.
1 month before, 2 months before. Now I'm seeing this. Is there anything wrong? Or it might be for other causes as well. There are many diseases where the patient can feel lump, like there are fibrocystic changes, or there can be another cyst, or in lactating breast, it could be galactocele, or normal tumor that we call fibroadenoma, whatever it is. But when they can feel the lump, they come to us directly. So that's the main point. They get to check their breast regularly, and they get to understand if there's any change, and they come to us earlier. But still, it cannot replace the importance of the screening method, that is mammogram. And it should be done actually, at least what we practice here, it once a year, starting from the age of 40, because we're getting patients at the earlier age. So we prefer it to start it from 40 years. And in fact, who has family history and also have the symptoms, or we have the suspicion in mind, we might advise for the mammogram at the early stage. So of course, it's very important to practice it, and we encourage all the person to go through the process of self-breast examination. And also it's important to do even after the menopause. It's very important, because at the patient is getting aged, they're getting the chance, they have the chance of getting cancer more.
Mhm.
So they should practice it as well. And for them, it should be any definite date of the month. They can do the uh, examination at the first of the month or any time, but it should be done every month once at least.
Well, people have many questions about mammography. What's the procedure of this? Is it painful?
Not exactly. Actually, what happens in mammographic technique, they use the X-ray as like we do the chest X-ray. It's similar to that, but the technique is a bit different. And what happens, it presses the breast to get the picture. So uh, many people might find it uncomfortable, sometimes a bit painful, depends on the condition of the breast, but it's not like it has to be a very painful thing, or as people assume that it might be something very, scary thing, or might be very painful. It's nothing like that actually. Most of the time, it's mostly it's discomfort. Sometimes it can be a bit painful because they use the pressure to get the picture, but there's nothing to be worried about it, that is it gonna be
Got it. Yeah. Hello, Dr. Afrin, can you hear me?
I can hear you. Yes.
Yes, yes, maybe there's some internet issues. Thanks for your Okay. Ruby Taranum has joined with us, and she has asked a question to Dr. Anil. She commented, I have pain in left breast. My doctor gave me USG. In report, multiple anechoic areas of variable sizes, 2.2 millimeter to 2.8 mm, are noted in all quadrants of both breasts. Is it serious or need any test for it?
So basically, very difficult on a Facebook show to really have a individual opinion. But looking at what the report is, looks what Dr. Afreen just mentioned about fibrocystic disease. These are, water-filled bags in the breast, and normally they are harmless. They are a part of the hormonal changes that take place, and do cause some discomfort and pain. But still, I would suggest that she should see her doctor, get herself examined, and rule out if there is anything that needs to be done. But prima facie doesn't look to be too bad.
থ্যাংক ইউ সো মাচ। দীপ সরকার প্রশ্ন করেছেন ব্রেস্ট ক্যান্সার কি কি কারণে হয়। ভাই আমরা অলরেডি এটা ডিসকাস করেছি, আশা করছি আপনি পরবর্তীতে আপনি মোস্ট প্রবাবলি এখন জয়েন করেছেন, পরবর্তীতে একটু প্রথম থেকে শুনে নিলে আবার আপনি এটা জানতে পারবেন। ওয়েল, শেখ ফয়জুল ইসলাম চুন্নু উনিও বলছেন ব্রেস্ট ক্যান্সার কি কারণে হয়, প্লিজ আমাকে জানাবেন, এটা নিয়ে আমরা অলরেডি আলোচনা করেছি। থ্যাংক ইউ সো মাচ। সাইদ মোহাম্মদ, excellent program, thanks a lot. Well, we have got a lot of comments. I'm just scrolling down. Well, Muhammad Noman, can breast cancer cure without chemo? Dr. Anil, please.
So that brings us to the question about the treatment of breast cancer. So we'll just briefly touch upon it before answering the question. Any cancer basically is treated by three main therapies, as we all know. It's surgery, radiation, or chemotherapy. Now, each of these treatments, as far as breast cancer is concerned, has really undergone a sea change. Previously, surgery was all about mutilating surgeries. A woman had to completely get the breast removed. And in fact, about 50 years back, even the muscle underlying the breast, even that arm muscle had to be removed. And this really led to a lot of difficulties. And the difficulty was that the arm used to get swollen. The function of the arm used to get affected, and was in general a very disfiguring and a very mutilating surgery. Science then progressed. People started realizing that it is not necessary to remove the muscle, and that is why they removed the entire breast and the glands which were there in the armpit. Then after a few decades, there was this lady, actually, there was this lady. Actually, it is a very interesting story which the audience would really like to hear. It came from a journalist called Rose, and she was this lady who had developed breast cancer, and she said, no doctor is going to remove my breast, I want it conserved. And from there on, there was research, and then people eventually got down to the idea that yes, breast can be conserved. So now the main therapy for breast cancer, the mainstay of surgery for breast cancer, is conserving the breast. Okay, so it is not only about adding years to the life of the patient, but it is also life to years, so that the body image of that person is maintained, and the self-confidence that a person has is also intact. So that is how surgery has changed over the years. Then you have oncoplasty, which Dr. Afreen will definitely enlighten you upon, and it is about maintaining the shape, the size, and the general cosmetic appearance of the breast. The second thing is about radiation. Has radiation changed? What is radiation? Radiation is giving X-ray therapy. Very simply put, very, very basic understanding is it is X-ray therapy. But that also has changed. Now you have such excellent software that you don't need to, sort of carpet bomb the entire chest. You can actually direct the rays to where you want. And that is why the side effects of radiation are a lot lesser than what they used to be. And now we finally come to chemotherapy. Now, people will do anything to avoid chemotherapy. They will undergo surgery, they will undergo radiation, they will do all kinds of traditional therapies, but they will not take chemotherapy. The people have a lot of misunderstanding also about chemo. One lady actually asked me in a public program that, do you use acid? So I said there is nothing like acid that is used. These are all medicines. Yes, they do have side effects because they are this. It's a strong disease, and whatever is a strong disease, you need a strong therapy to deal with it. And that is why what these medicines do is they kill all the cancer cells. And unfortunately, as we have a saying, in a forest fire, the dry and the wet, everything gets burned, and that is why some of the normal tissues get affected as well. That is why people lose hair, they have a little bit of nausea, they have some vomiting. But the good news here is that now there are excellent medicines to actually counter these side effects. Okay, so previously people used to vomit a lot. Now we hardly see any vomiting in treatment of breast cancer. Yes, hair loss is there. There are various things done in order to reduce the hair loss. Not all of them have succeeded, but I have yet to see in my 25 years of experience a patient not growing back her hair after chemotherapy. So all of them recover their hair. It's only that temporary period when they are undergoing treatment that there is hair loss. In fact, we have a support group, and those ladies actually use a lot of interesting headwear, so in order to get over that feeling of losing hair, so they even conducted a fashion show where they displayed that headgear in order to avoid in order to get over that feeling of losing the hair. So people really, if you want to be positive, then you can do a lot of things to get over that feeling. The second thing is that now you have what is called as targeted therapy. So that therapy actually acts only on the cancer cells, mostly on the cancer cells. So the side effects are much lesser. So it may happen that treatment may go on, that cancer treatment may become reduced to just taking pills, and maybe Dr. Afreen and I will be just doing these Facebook shows and not operating at all. But that's really in the future. So now coming to the interesting
Fun.
question is that whether cancer can be cured without
But I
chemotherapy.
won't
A
appreciate that.
very
I want to do the surgeries.
no, don't worry. It's still a fairy tale as of now. It's still science fiction. At least our lives will go. But anyways, can cancer be cured without chemotherapy? A very very small proportion of breast cancer patients who are diagnosed very early and have hormone receptors in the breast tumor, in the breast cancer, can get away without doing chemotherapy. So, all my words are important. Early diagnosis, small tumors, and tumors which have a certain characteristic of having hormone receptors. Now, all breasts have estrogen, that is the female hormone receptors in the breast, but some tumors do not have these receptors. So, only tumors which have these receptors and are small enough not to require chemotherapy will be escape taking chemotherapy and can be treated with just tablets. But for that, again, let me come back to my basic thing: get yourself diagnosed early. Don't ignore a small breast lump. That is how you can reduce treatments, reduce the cost, and get cure.
Thank you so much, Dr. Afrin. If you want to add something, and one question to you, Mukleswar Mondal has joined with us, and he asked, when do you suggest to take radiotherapy for breast cancer patients?
Okay,
Dr.
is
Afrin.
the question for me?
Yeah. Yes.
Okay,
Yes.
okay. So I don't know whether he was listening to Dr. Anil because he has explained it like I think quite elaborately. Because cancer treatment, it's not like only the surgeons are doing it or the oncologists are doing it. It's basically a teamwork. Lots of people are involved in giving the treatment of a cancer patient. Because if we start from seeing the patient, like when the patient is coming to me as a surgeon, at first I'm seeing the patient, I'm doing the triple assessment, I'm diagnosing the patient and staging the patient. That much is very important, that you need to know the disease first. You have to have the confirmatory diagnosis with the histology, and for that we use the core biopsy. Now it's very important to let people know, because there are so many people who is like, what is this biopsy? Why do you need to do the biopsy? Why can't you go for the surgery directly? Why do we have to have the histological diagnosis before? It's very important to have the histological diagnosis to give the treatment properly. As the doctor is mentioning, that there are a few things that we need to consider when you're giving the treatment to the patient, especially just as because it's an hormone dependent tumor. Treatment can be completely different depending on the receptor status or immunohistological diagnosis or the biology of the tumor, at what stage the patient is coming to us. So it's very important to have the proper diagnosis with the molecular biology and at the stage of the disease as well. So the question the person was asking is about the radiotherapy. It's basically depends on the stage of the tumor. So when the patient is coming to us at the earlier stage, at very early stage, like stage 1 and 2, when the tumor is in the breast, is the small tumor. And sometimes when it goes to the axillary lymph node, what we say, or how can you say, the glands in the armpit, we can still treat the disease as early stage disease. What we can go for is the breast conservative surgery. But when the patient is going through that procedure or breast conserving surgery, it has to the patient has to keep that in mind, that he or she has to go through the radiotherapy afterwards. It's a must. So that is one thing. When the patient is receiving the breast conserving surgery, there has to be a process of radiotherapy afterwards. And also when the tumor is larger in size, which is very big, or when it's involving the chest wall muscle where the breast lies, that is the pectoral muscle, the patient needs radiotherapy at that time as well, or sometimes depends on the nodal involvement or the glands it has involved. So but the radiotherapy thing or the chemotherapy, those are actually decided by the oncologist. There are different specialty person that are involved in this treatment procedure, like the medical oncologist or radiation oncologist. They basically they decide on the treatment what the patient should get. But these are the few situations the patient needs to get radiotherapy. When the patient is getting breast conservative therapy, when the tumor is very big in size, when it's involved the chest wall muscle. So I think that
Yes.
answered the question the person asked me,
Thank you.
hopefully.
Thank you so much. We are getting lots of questions here. I don't know whether we can take all the questions in a very short time. Yasin Munshi has joined with us, and yes, I have also questioned to Dr. Anil. My wife is having nipple discharge more than a year. Ultrasound doesn't show any lumps. Is there any chances of cancer? Yeah.
A very good question. Yeah. So basically, we all doctors talk about nipple discharge being one of the symptoms of breast cancer. But what is important is that not all nipple discharges are symptoms of breast cancer. Uh, there are a lot of women who would have a colorless discharge or a milky discharge or a white discharge or a green discharge or a yellow discharge. These are all, a lot of times, they are normal secretions of the breast and are related to hormonal changes that occur. What is alarming and what should cause concern is basically reddish or blackish or bloody discharge from the breast. If something like that is happening, I think you should see a specialist surgeon, not just any surgeon or a gynecologist. See a specialist surgeon and get yourself examined and treated if necessary.
Thank you so much. Dr. Rafi ma'am, two questions for you. Noushin Yasmin. Is there any chance that a person who had tumor once can get cancer later, even after removal of the cyst? And another question is, at what age and how often should mammography be done?
Okay, so the first one, she asked whether the patient has a chance of getting the tumor again,
Yes.
but she didn't mention whether it was cancer or not. So as she mentioned cyst, I think she's asking if the person have any kind of tumor removed, whether she has the chance of getting the tumor again. So the thing is, usually the kind of tumors that we deal with, there are two types. If we say it broadly, that one is cancerous and others which are not cancerous. So if we talk about the non-cancerous things, which is benign diseases, for an example, which is a very common tumor, is fibroadenoma. This is kind of tumor which the young women gets very often, and it's a mobile tumor. It doesn't it's not sinister to any extent usually. So this kind of tumor, these questions we get a lot. If we remove the tumor, whether there is any chance of getting it back. So there is actually no definite, I think, studies to say that whether it's coming back or not, because we are just removing the tumor. You're not removing the breast. So as the patient get the tumor, like as a normal person, so she might get the tumor again or not. There is no definite thing to say that she will get the tumor or she will not. But in case of cancer, what happens? It depends on the stage of the cancer. When it's the earlier stage, the patient is getting the treatment properly. She's receiving all the treatment. She's on regular follow-up. So there is very less chance of getting the cancer back with the proper treatment. If the cancer is at the early stage, they're coming to us at the early stage. But of course, as Dr. Anil has already mentioned, you cannot say anything for sure. There are a few percentage of cases where there is always risk of recurrence, where the patient can always get back the tumor. But still, what we say, if the earlier stage with the proper treatment, patient gets cured at a very good percentage. So that's the thing we need to keep in mind. We cannot say anything for sure because it's always the Almighty who actually make the people healthy or well. We are just trying to help the patient. So we can say a few things with the studies and everything, like this should be the result or this can be the result, but we cannot say anything for sure. There's always a chance of getting recurrence in case of cancer. If the disease is at the advanced stage, the risk is more. That is the thing.
Okay.
So,
Another question was,
can I
yeah,
just
please.
add to that? So,
Sure, sure.
even after a person gets recurrence, so it is just not yet the end of the road. So, few years, a few say a decade or two back, it used to be that once a patient gets a recurrence, it used to be just the full stop. Just take him to his village, just do some seva and let him pass on. But now, if a person gets a recurrence, there are treatment options. And even in metastatic breast cancer, which means when the cancer has relapsed or spread, people do not give up. There are treatments available. And definitely, I think a good quality of life and extension of life is definitely possible for that person. So not giving up complete hope as yet.
Thank you.
Exactly.
Uh, yeah, Dr. Afrin ma'am. Second question was, at what age and how often should mammography be done?
Oh, I think we already talked about it because mammographic screening, every healthcare system has their own policies for that, but we can't say anything about our country because we don't have anything like specific that it should be started at this age or it should be done like this. But what we practice here, as we are getting patient at the earliest stage, so we prefer to start the screening process where it's possible from the age of 40 years, once a year, at least. If it's not annual, at least twice a year, they should go for it. That's what we suggest. And with the family history or with the more risk factors, it can be done earlier, but depends on, it should be individualized actually, because we're not practicing the screening method as it should be as like for mass people. We still advise for the screening for those patients who are coming to us. It's not like for general population. So when the patients come to us, we see the patient and then advise for it. But when they have the risk factor or family history or something, some kind of symptoms that we are suspicious of, then we can suggest for it at the early stage as well, like around 35. Because before that, it doesn't give any very good result for interpretation. So we don't prefer it before the age of 35.
Thank you so much. We will come back to you. There are more questions to you actually. Dr. Anil sir, my question is: can breast cancer be transmitted from one person to another, and can a lactating mother develop breast cancer?
Oh, no, never. So, no cancer is a communicable disease. And all cancer patients require help. They require, I won't say sympathy, but they definitely require empathy. They should, they need not be, locked up in a room and given food through a small window. So, that's not what cancer patients require. And no cancer can be transmitted from one person to another, not through any means. It's not an infectious disease at all. And this needs to be printed in bold letters and underlined thrice, not twice, thrice. that it is not a communicable or not a infectious disease. Coming to the second question, can a pregnant or a lactating mother get cancer? Yes, unfortunately, there is a very rare type of cancer that is called as inflammatory breast cancer, which can happen in lactating or pregnant ladies as well. It is supposed to be a very aggressive cancer, and if it happens in pregnancy, we have dealt with such patients, and it is still possible now to continue the pregnancy, still get and the treatment of breast cancer as well. It is not that every pregnancy needs to be terminated, but then it is an absolute teamwork with the gynecologist, with the medical oncologist, with the breast cancer surgeon. So it requires an institutional support and for the treatment of these patients. So can happen, but yes, there is a way.
Thank you so much. One more question to you. Jasmine Ara Anjali, she asked how many years a woman can live with metastatic breast cancer.
So as I said, it differs. So it is not there is no one figure fits all kind of answer. It depends on how extensive is the spread of cancer, how many years have passed since she's taken treatment for the primary breast cancer. So all these factors play. So I have patients who had developed a spread in the bone, and they are living for 10 years also after that incident occur. And there are patients who may develop extensive spread everywhere, in the liver, in the bone, in the brain, in the lungs, and then succumb to the disease within 2 years of treatment. So you can't really generalize that answer. It is very, very individual.
Thank you so much, Dr. Afrin ma'am. Coming back to you, Ruby Taranum, she asked a question to you. If fibrocystic changes are converted to cancer, is anyone need FNAC test for fibrocystic changes?
Her concern is if a patient with fibrocystic change has more risk of developing breast cancer, I guess
Yes.
so. So the thing is, it doesn't put any more risk than any normal individual because it's just a fibrocystic change. What we say, it's a physiological change that happens in women's breast. It's completely related to the hormonal imbalance. But what happens is, as I mentioned already, it's a hormone dependent tumor. So when there is chance of more hormonal exposure, there's always a risk of more cancer. As Dr. Anil already mentioned when he was mentioning about the risk factors, he said already, when the patient is having longer reproductive period, which is early menarche and late menopause, or in our country, people are taking lots of hormone replacement therapies or hormonal pills without doctor's prescriptions for a very long time. So these are actually, influencing the risk of developing breast cancer. But if we specifically talk about the fibrocystic change or fibrocystic disease, it doesn't specifically increase the risk of breast cancer, but as like any other person, she might get the breast cancer, but the risk is not more. And the second question, she was asking for FNAC, for fibrocystic
Yes.
change. Okay. Fibrocystic change, as I mentioned already, is a physiological change, but sometimes it depends on the cyst size and the complexity of the cyst. If it's a simple cyst, small size cyst in a younger patient, the patient doesn't need to go through any kind of invasive procedure. But if the patient is elderly, she's having complex type of cyst, a larger cyst, she might need to go through a FNAC procedure. It depends on the patient's finding in the ultrasound. So it should be individualized. What is the patient is going through? What's the risk? Uh, and what is the necessity of doing the test actually? So it's not like you cannot say for everybody has to go through the FNAC procedure. It depends on the finding in the ultrasound.
Thank you so much. জিনিয়া সরকার প্রশ্ন করেছেন 8.5 mm and 0.5 cm deep to the skin fibroadenoma এর জন্য কি করব আফরিন সুলতানা আপু, এখন কি অপারেশন করা যাবে কিনা, আর এখন ট্রিটমেন্ট লেট করা যাবে? এখন ট্রিটমেন্ট করাতে পারছি না কারণ করোনা, রোগীর এইজ 22.
আচ্ছা, so basically ওনার যে কোয়েশ্চেনটা, she is very young and she is already mentioned the finding in the ultrasound. খুবই স্মল সাইজের একটা টিউমার and it's fibroadenoma. আমি জানি না ওর কোনো এফএনসি বা বায়োপসি করা হয়েছে কিনা, She needs to go through a invasive process. It could be FNAC
Mhm.
or core biopsy, whatever it is. And if it's mentioning the tumor is actually fibroadenoma, she can wait for it. It's a very small size tumor. এত ছোট সাইজের টিউমার আসলে সবসময় অপারেশন করার দরকার হয় না। যদি এটাতে রিপোর্ট ভালো আসে যে ফাইব্রোডেনোমায় আসলো, অন্যরকম কিছু আসেনি, এই ধরনের টিউমার গুলোকে আসলে আমরা মনিটরিং করতে পারি। একটা সার্টেন সাইজে যাওয়ার আগ পর্যন্ত আসলে আমরা সার্জারি সবসময় অ্যাডভাইস করি না। সো এখন এটা আপনার জন্য ম্যান্ডেটরি না যে এখনই অপারেশন করতে হবে। We can wait and watch. We can review the ultrasound scan after 3 months and see how it's going on. And if the size increases, then we can think about it, the patient needs surgery or not. But at this moment, right now, she doesn't need it.
Thank you so much, Dr. Answer. Nurjahan Begum has joined with us, and her question is breast cancer can be transmitted by breastfeeding?
No. As I mentioned already, it is not a communicable disease. It doesn't get transmitted through from one person to another by whichever means. Not at all.
Okay. Thank you so much. Fatima Shumana also has joined with us, and the impact of breast cancer and its treatment methods, such as uh, mastectomy on patients, include adverse effects on mental health, particularly mood disorders. How to deal with that? What's the role of the family here?
Oh, very, very important question, and definitely goes beyond medical treatment. She's raised a very important point, and that is the whole reason why breast conservation techniques came into play. So people have to realize that mastectomy is a devastating procedure for many women, and it is not just about appearance. I had this lady who came in. She was an old lady, old in the sense she was in her 60s. She said she didn't want to get treated for breast cancer, and I asked her why. So she said that I know you will remove my breast, and if you remove my breast, I have two children of marriageable age, and they will not get married. My heart went out for her, because you realize that this lady was willing to, as Afrin said, willing to sacrifice her life so that her children will get married. Because, as I said, we live in very conservative societies, and there is a lot of stigma that happens with cancer as well. I don't know why, but it is still there. So yes, you have raised a very important question. Mental health is definitely important, and we can, most of the cases now are treated without removal of the breast. So that's a blessing. The second thing is, we need family and social support for these people. So what is important is that we need to have support groups. Now, that's a very common thing in the West, but now even in our societies, we need to form these groups. We have at Fortis a very good support group that is carried on by patients themselves. So they have programs, they have discussions, they have picnics, they have a lot of fun. Uh, because there are certain problems which are unique to these patients. So no doctor can really solve them, because the common thing in the patient's mind is that you're a doctor, you will say all these things. आपको बोलने को क्या जाता है? So it is that philosophy that is there. So when a patient says it, it becomes a lot different, and that is the best counseling that is done. We also need to have a counselor for all these patients. There are a lot of marital issues that crop up after cancer treatment. Uh, in Tata Hospital, where I trained, we used to see a lot of these lower socioeconomic women being abandoned by their husbands because they had undergone breast cancer or some kind of cancer surgery. So, a lot of societal issues, and that is where I think society needs to stand up for these women, support them, and not treat them as outcasts. So, all these things, that this is not a communicable disease, this is not a disease which is a curse. All these things are important, and these need to be emphasized. And we must have support groups formed by these patients, which are supported by the society, so that they can interact, they can come out with their problems, and they find support in all this.
Thank you so much, Dr. Afundami. If you would like to add something in Bangladeshi context.
I think the scenario is quite similar in, we know we are the neighboring countries, we share same kind
Yes.
of mind thoughts and cultures and whatnot. So I think it's quite similar here as well. But I should mention that in India, the things are quite improved compared to us, especially these kind of things, the mental issues and everything. We don't have these kind of support groups or anything. People still don't understand the importance of this mental status or mental health issues of any person, not only the patients. In fact, when there is a cancer diagnosed in the family, it involves the whole family. Actually, it's not only that person. It involves the a person she is married to or she is related to, because in our society women are the person who takes care of the family, so everyone gets devastated, and especially the personal relations in marital status, the husband wife relation gets hampered a lot, and the social stigmas are there always. So it's very important to have your family there. It's very, very important, especially the male counterparts, because in our society women are so dependent on them, not only for money or social support or everything. In fact, they are not able to tell their feelings to anyone because they are completely dependent on the person they're married to. So it's very important they understand that they're not only there, you know, as they're not there just they're married. They has to be there as a friend or whoever there is for them, their friends, family. It's very important they understand what the person is going through at that moment, because he has been dealing with so many things at the same time, not only her health issue, because it's a visible organ, whenever she has gone through the surgery, even if it's mastectomy or breast conserving surgery, whatever you say, she can see the changes every time it's happening. In other surgeries they don't get to see what's happening inside, but in breast cancer it's very visible for the patient and the partner. So it's very important that you give the support to the person who is going through this, and it's a lot. As because we don't have any support groups here, I think the best we can do, uh, the family we have around, the friends we have around, especially the person we live with, our neighborhood, or our society, we need to improve our mentality a bit. And the things doctor already mentioned, that these kind of things is gonna spread from one person to another, or she must have done something wrong, but why, or else why she should get the cancer or something. So these kind of things we need to get out of this mentality, and at least if we can't even support the person, we shouldn't pull her down or we shouldn't pull her back. So that's the least we can do actually.
Thank you so much for your valuable comment. We are almost at the end of the show, but I would like to take two or three questions at the end. Dr. Anil, just in this present situation, as corona pandemic is here now, right now, so how we what to do if a breast cancer patient is having a corona effect?
Very important question. So this was this we have spent innumerable hours in webinars talking about this situation. So there are certain guidelines. So it depends on, the first thing is that we must remember that cancer cannot wait. Cancer treatment has to go on. But of course, when a patient has an active COVID, when he is infected with the COVID, then going ahead with cancer treatment becomes a little dicey, becomes a little dangerous, because if surgery is conducted, it requires anesthesia, and it has been shown that it can be a potentially fatal thing in about 1 in 4 patients. So we do wait for a period of at least 15 days till the symptoms of corona settle down, till he becomes negative, and then go ahead with cancer treatment. And that period usually does not really have too many implications as far as the progress of cancer is concerned. As regards people who are not infected with the COVID virus, I do not think they should wait till the COVID situation settles down. We already know we started off with a month, then it went to 2 months, then now it is almost 8 months. We are into the pandemic, and still there is no sign of it really abating. So COVID has now become a part of our lives. We have to carry on. Life cannot wait. Cancer definitely cannot wait, because we have seen, it is estimated that there will be at least 18,000 more deaths, even in the United Kingdom, because of cancer, just because of COVID. So they are now seeing patients like we see, advanced cancers, large cancers because there is no screening happening. People are not going to the hospitals. So let us not do that. Uh, I am sure hospitals take everywhere are taking all kinds of precautions for you. So do not delay going to the doctor just because there is a COVID situation. If there is a lump, again, I know I'm repeating myself like a stuck record, but this is so important that you need to know that you have to go to the doctor if you have a painless
Sure.
bleed.
Thank you so much. Samina has joined with us, and she wants to know about the treatment procedure in Fortis. Do you have any package, and do you provide chemotherapy and all?
So we are a comprehensive cancer institute. We have all facilities under one roof, right from diagnosis. We have with mammography, 3 Tesla MRIs or a PET scan to doing advanced genetic tests, doing all kinds of surgeries, radiation therapy, and chemotherapy as well. We have a separate daycare ward for the same. We have all specialities. In fact, we have fellowships for in certain departments in cancer in medical oncology as well as in colorectal cancer surgery with our department. So we are a postgraduate training institute as well. So we do have all kinds of facilities for training for treating any cancer patient, specifically breast cancer patients. As far as the cost of treatment is concerned, it would obviously vary from patient to patient. There are definitely packages which are there, but for that, I would not be able to sort of talk about generally about the cost. But definitely, it is something which is far lesser than it would be in any kind of any Western country at a cost which would be probably far less.
Thank you so much. Dr. Afrin, ma'am, the treatment process in our country, and as you were oncosurgeon, so would you please share the treatment cost? We know cancer treatment was always expensive, so people have that knowledge. So please, would you please let us know the treatment cost?
Uh, Actually, what happens in our country, we provide the treatment basically two, I can say two facilities are there. One is the government facility and another is the non-government one. So as far is concerns the treatment expense, whoever has the limitations of expenses, I think they should go for the treatment in government facilities. There are a few drawbacks, of course, because if you're getting the treatment for free or very lesser expense, you have to deal with certain things. There are some systemic issues there. You gotta wait for long time, maybe sometimes for the schedule, especially for the radiotherapy and chemotherapy things. But surgery, you don't need to wait for that long. But for radio and chemotherapy, people might have to wait for longer time. So when it concerns the expense, I think people should go for government system therapies, which is, I can say, almost nil. You can say that they're getting it for free. But when people are more into like service oriented treatment, I think it's the non-government facilities. There are many kind of institutions available here. There are medical colleges and they're completely, clinic basis treatment. So, and the treatment is always individualized and it also depends on the institution the patient is getting the treatment. So like in medical college, the treatment expense is different, but in like any kind of corporate hospital, it's a bit different. So, and also it depends
Okay.
on what kind of therapy the patient is receiving. If the patient is getting chemotherapy, their drugs are different. They can use which are locally made drugs, or we can use the drug from outside, which are, we're getting from outside. The expense is different. And when the patient is getting targeted therapy, the expense is more. And when the patient is getting
Mhm.
hormone therapy, the expense is different. So basically, the treatment expense is very individualized, and it depends on when the patient is getting the treatment, what is the stage, and what kind of tumor they're getting the treatment for. So it's very hard to tell you, the specific treatment expense.
Yeah, sorry, that was actually a question from our audience. Dr. Afrin, many of us, oh, people are asking about your chamber address. Will you please share?
Okay, so everyone is welcome if they have any health concern or issues about their breast disease or any concern about that. They can visit me in City Hospital, which is in Lal Matia. I hope people know the place. So I see the patient there almost every day except Friday. So I will give the number here for the serial or contact, or if you have any question, I have a page available, or so you can post your comment there, or you can see me directly, whatever
Yes.
feel comfortable for you. I see the patient in City Hospital Limited in Lal Matia.
Diana Maliat already commented Dr. Afrin would like to take an appointment, but in morning, please not at night. Any slot for physical appointment in morning. So I think she's
In
struggling with the appointment.
or the thing is, morning it's not possible for me because I'm doing a job where I don't see the patients in the morning. So if you want to see me individually, like if you want to get my appointment, it has to be in the evening. I don't see patients in the morning because I have different job descriptions in the morning. It doesn't include seeing the patients. So yeah, you have to come to me at the evening. Sorry about that.
Thank you so much. Dr. Anil sir, last question for you. Ajat has joined with us and he asked, in this corona pandemic, how we were treating international patients. Is there any procedure to get medical visa or something like that? Can you help consult help?
So yeah, there is. We have started getting patients back. People are starting to travel. There is this bubble agreements that are there between countries. So in fact, we recently had a patient from Bangladesh itself. So we are getting patients. Visas are definitely processed in there with whatever government this thing is available. And I think if you write to us at the mail that was shown, we will spell out the procedure for you, and we will make sure that uh, you you get all the document. We'll help you with the documentation as well.
Thank you so much. It's almost মানে এক ঘন্টারও বেশি সময় হয়ে গেছে। So one hour. So we would like to end the program here right now. As though we are getting so much questions that we couldn't take all of them, and then 2 hours will. And so yeah, Dr. Anil, if you want to say something at the end of the show to the audience.
No, thank you. It was a very engaging and very interesting conversation, and you made it very interesting. And Dr. Afreen as well. It was nice to interact with you and nice to interact with all your viewers. Very interesting, very insightful questions. Loved answering them. My last message is again the same thing. Do not ignore your symptoms. Do not lose hope. Cancer is curable if detected early. Just get it in bold letters imprinted on your mind. So stay safe, stay healthy, and have a great life.
Thank you so much, Dr. Afrin.
আমি আর কি বলবো it was a nice experience actually. I like the idea of sharing thoughts and experiences between two countries because we have been living same kind of lives in these two countries, so we have same kind of environment, our demography is similar, our disease patterns are similar. So I felt it very engaging as well because I get to know the situation over there and how you're dealing with the patients, especially in this pandemic situation and everything. And we can even compare what's happening in these two neighboring countries. So I think it's also very helpful for me as well to understand what's happening there. And it feels good when you get to know more about what's happening in the world, and you can enrich yourself as well. So thank you so much, Dr. Anil, for sharing your experience and your knowledge with us. I felt
Thank
it
you.
very helpful for me as well. I think our audience is also, uh, I think they learned a lot from
Yes,
here because,
yes.
when you listen to more people talking about the same thing in the same way, they feel it more connected and they learn more from it. And they, I think, feel more confident about it. Okay, this is what's happening. This is the same everywhere. Actually, it's not like it's here in it's they're saying the doctors are saying different things here or different things there. It's nothing like that. So it's kind of similar everywhere. The disease is real and it's there and it's same for every person. So people understand that and they internalize it more. So thank you so much for being with us and sharing your thoughts, and hopefully সবার অনেক help হয়েছে, hopefully. So সবাই
Thank you
ভালো
so much.
থাকেন।
Yes, we are getting
Thank
lots
you.
of positive
Thank you.
comments. As Yasin Munshi told us, we really need more of this kind of show. Thanks all of you for good work. Thank you so much for staying with us. Uh, thanks, thanks Dr. Afrin ma'am, and thanks Dr. Oil sir for joining with us.
Thank you.
Thank
Thank you. Thank you
Yeah,
so much.
take care.
Bye.
Bye. So, দর্শক আপনারা 1 ঘন্টা 20 মিনিট হয়ে গেছে আসলে ব্রেস্ট ক্যান্সার এই জিনিসটা নিয়ে আসলে আমরা স্টিগমাটাইজ সোসাইটি যেখানে আসলে মেন্টাল হেলথ নিয়ে খুব একটা বেশি কথা বলা হয় না, আর ব্রেস্ট ক্যান্সার এটা আসলেই একটা ডিফারেন্ট একটা ভিজিবল অর্গান, এবং সবাই এটা নিয়ে কথা বলতে খুব লুকোছাপা করে এবং খুব গোপনীয়তা রক্ষা করা হয়, অথচ এটা ওয়ান অফ দা মানে এক ক্যান্সারের যেখানে ডেডলিয়েস্ট ক্যান্সারের ইয়ের মধ্যে 1 নাম্বার, যেটা আমরা আজকের আলোচনা থেকে উঠে এসেছে। এবং পুরো ব্যাপারটাতে আমরা চেষ্টা করেছি আপনারা যারা যারা কমেন্ট করেছেন সব কমেন্ট গুলো আমরা আমাদের যে বিশেষজ্ঞ চিকিৎসক দুজন ছিলেন তাদের কাছে পাস করার এবং তাদের কাছ থেকে প্রয়োজনীয় পরামর্শগুলো আপনাদের কাছে পৌঁছে দেওয়ার। যদিও আরো অনেক অনেক প্রশ্ন ছিল এবং আমাদের আরো অনেক কিছুই জানার ছিল, কিন্তু আসলে এত স্বল্প সময়ের মধ্যে পুরো ইয়েটা আসলে কভার করা সম্ভব হয়ে ওঠে না। তো আমাদের সাথে আজকে যুক্ত হয়েছেন বাংলাদেশের অতি পরিচিত অঙ্কোসার্জন ডক্টর আফরিন সুলতানা, এবং ইন্ডিয়া থেকে জয়েন হয়েছেন মুম্বাই ইন্ডিয়া থেকে ফোর্টিস হসপিটাল সিনিয়র কনসালটেন্ট ডক্টর অনিল হেরোর। তো আমরা দুজন সিনিয়র এক্সপার্টের কাছ থেকে আমরা জানতে পারলাম আজকে ব্রেস্ট ক্যান্সার সম্পর্কে, এবং মোদ্দা কথা যেটা মেইন থিং যেটা অ্যাট দ্য এন্ড অফ দ্য শো আমরা বলতে চাই, ডক্টর আফরিন ম্যামও সেটা বলে শেষ করেছে এবং ডক্টর অনিল স্যারও, যেটা হচ্ছে যে আর্লি ডিটেকশন, এবং আসলে এটা নিয়ে হেলাফেলা করার কিছু নাই। কোনো কিছু হলেই জাস্ট ওপেন আপ আপনার পরিবারের কারোর সাথে কথা বলেন এবং ডক্টরের কনসালটেন্সি নেন অ্যাজ আর্লি অ্যাজ পসিবল। এবং যেহেতু এটা খুব বার্নিং একটা ইস্যুস হয়ে দাঁড়িয়েছে, তো এটা নিয়ে আসলেই এখন আর হেলাফেলা করার সময়টা আমাদের নাই। তো সবাই খুব ভালো থাকবেন। আহ, যে কোনো প্রয়োজনে এবং ফার্দার কোনো রকম কোনো প্রয়োজনে বা কোনো ডক্টর কনসালটেন্সির জন্য আমাদের সাথে আপনারা যোগাযোগ করতে পারেন, আমাদেরকে ইনবক্স করতে পারেন। অ্যান্ড ফোর্টিস হসপিটাল আজকে আমাদের এই অনুষ্ঠানটা পাওয়ার বাই ফোর্টিস হসপিটাল মুলুন্ড মুম্বাই ইন্ডিয়া, অ্যান্ড আমাদের সঙ্গে মিডিয়া পার্টনার হিসেবে ছিল রেডিও আমার 88.4 FM। তো সবাইকে অনেক অনেক ধন্যবাদ যে যেখান থেকে আমাদের সাথে যুক্ত হয়েছেন এবং এতক্ষণ যাবত আমাদের সঙ্গে ছিলেন। সবাই খুব ভালো থাকেন, সুস্থ থাকেন, আহ এবং করোনা পরবর্তী সময় ইনশাল্লাহ সবার সাথে সুস্থভাবে আবার দেখা হবে। স্বাস্থ্যবিধি মেনে চলবেন। আসসালামু আলাইকুম, শুভরাত্রি।